Ever wondered about the impact of alcohol on your health? You're not alone. Alcohol, a substance that's so prevalent in our society, carries with it a host of implications, both for our physical health and our mental well-being. Let's start with a basic understanding. Alcohol, often associated with social gatherings, celebrations, and relaxation, is a psychoactive substance. It's the active ingredient in drinks like beer, wine, and spirits, and it can have a profound effect on our bodies and minds. It's interesting to note that alcohol use is quite widespread. In fact, it's estimated that between 10 to 15% of patients in family practice are considered problem drinkers. This means they consume alcohol in a way that's harmful to their health or their social and personal lives. And the impact of alcohol extends far beyond individual drinkers. It's estimated that alcohol plays a role in 20 to 50% of hospital admissions. Furthermore, alcohol is implicated in 10% of premature deaths, 30% of suicides, and 50% of fatal traffic accidents in countries like Canada. This widespread use and the subsequent impact of alcohol is not distributed equally among all demographics. It's more likely that the diagnosis of alcohol-related problems gets missed in women, the elderly, and patients with high socioeconomic status. These disparities highlight the need for a nuanced understanding of alcohol use and its implications. Alcohol, while often enjoyed responsibly, can lead to serious health consequences when misused. Chronic heavy drinking can lead to conditions like liver disease, heart problems, and increased risk of cancer. Not to mention its potential to lead to alcohol dependence or addiction, a serious condition that affects not only the individual but their families and communities as well. So we've established that alcohol is a significant part of our society. But how does it interact with our bodies? What effects does it have on our physical and mental health? It's clear that alcohol plays a significant role in our society, but what exactly does it do to our bodies? How do we determine if someone has a problem with alcohol? Let's delve deeper. To identify a potential alcohol issue, healthcare professionals often utilize a diagnostic tool known as the CAGE questionnaire. This brief, 4-question survey is a potent first step in identifying alcohol dependence. It derives its name from the 4 criteria it assesses, which are encapsulated in the acronym CAGE. Each question of the CAGE questionnaire is devised to unravel potential signs of alcohol dependence. C stands for cut down, asking whether the individual has ever felt the need to cut down on drinking. A stands for annoyed, probing if the individual's drinking has ever annoyed others. G stands for guilty, questioning whether the individual has ever felt about their drinking. Lastly, E stands for eye-opener, inquiring if the individual has ever needed a drink first thing in the morning to steady their nerves or cure a hangover. The scoring system for the CAGE questionnaire is simple. 1 point is given for each yes answer. A score of 2 or more implies potential alcohol problems in men, while a score of 1 or more in women suggests the same. The CAGE questionnaires sensitivity, its ability to correctly identify those with alcohol issues, is 85%. Its specificity, or its accuracy in identifying those without alcohol problems, is 89%. Remember, the CAGE questionnaire is not a definitive diagnosis tool, but an effective screening method. If a person's score indicates a potential problem, exploration is warranted. Beyond the CAGE questionnaire, it's essential to examine the individual's drinking profile. This involves understanding the context of their alcohol consumption, the setting, time, place, occasion, and the company they keep when drinking. These factors can provide valuable insights into an individual's relationship with alcohol. Another critical part of the assessment involves analyzing the impact of drinking on various aspects of the individual's life. How does alcohol affect their family relationships, work performance, and social interactions? Are there any unsettling patterns or incidents related to their drinking habits? Additionally, the frequency and quantity of alcohol consumption need to be evaluated. Questions like how many drinks per day and how many days per week help sketch a comprehensive picture of the individual's drinking habits. If the assessment identifies a potential alcohol problem, further screening for other drug use is necessary. It's also important to identify any medical or psychiatric complications, inquire about drinking and driving incidents, and ask about recovery attempts and the individual's current readiness for change. Identifying an issue is the first step towards addressing it. Equipped with the right tools and a comprehensive assessment, we can help individuals grappling with alcohol dependence take the first critical steps towards recovery and a healthier life. Once we've identified a potential issue, what's next? Investigations. These are crucial in determining the extent of a person's alcohol dependence and the impact on their overall health. One of the key investigations involves gamma-glutamyl transferase, or GGT. This is a liver enzyme that can be elevated in conditions where the liver is under stress, such as excessive alcohol consumption. An elevated GGT level may suggest an issue with alcohol dependence. Next is mean corpuscular volume, or MCV. This is a measure of the average size of your red blood cells. Alcohol can cause these cells to enlarge, so a higher MCV can be an indicator of heavy drinking. Then we have aspartate aminotransferase and alanine aminotransferase, known as AST and ALT. These are enzymes found in your liver and other organs. An AST to ALT ratio that approaches 2:1 may suggest alcohol-related liver disease. A complete blood count or CBC can also be conducted. This test measures different types of cells in your blood. In the context of alcohol dependence, we're particularly interested in signs of anemia or a low platelet count, which can both be caused by chronic heavy drinking. Lastly, there's INR, or International Normalized Ratio. This is a measure of how long it takes your blood to clot. Chronic alcohol use can decrease clotting factor production by the liver, leading to a higher INR. It's important to note that these tests are not conclusive on their own, but they can provide valuable information when viewed as part of a larger picture. They can also serve as a baseline for monitoring progress as a person works towards recovery. The process of investigating alcohol dependence is not just about identifying a problem. It's about understanding the full scope of the issue and how it's affecting a person's health. These tests give us a way to quantify the impact of alcohol, to track changes over time, and to guide decisions about treatment. These investigations can provide critical insights into a person's health and the impact of alcohol. Before delving into the treatment, it's crucial to understand what alcohol dependence is and where it stands in the continuum of alcohol use. Alcohol dependence, often termed as alcoholism, is a severe of alcohol abuse that involves a physical dependence on alcohol. It's at the far end of the spectrum, which starts with casual drinking, moves through alcohol misuse and abuse, and ends with dependence or addiction. This range reflects a progression where alcohol use becomes increasingly problematic and damaging. Alcohol dependence doesn't only disrupt the life of the individual, it also has severe adverse medical consequences. Problem drinking can lead to significant issues with the gastrointestinal, cardiac, and neurologic systems. It can cause liver disease, pancreatitis, cardiovascular problems, stroke, and neurologic complications like dementia and neuropathy. Hematologic problems can also result, including anemia and coagulation disorders. Further on, problem drinking can lead to non-medical issues such as trauma from accidents, insomnia, family violence, and social or family dysfunction. There's an increased risk of mental health disorders like anxiety and depression, and sexual dysfunction is also common. Pregnant individuals who drink risk damaging their fetus, leading to a range of problems known as fetal alcohol spectrum disorders. Now, let's discuss the treatment strategies. Firstly, it's important to understand that managing alcohol dependence is not a one-size-fits-all approach. The script continues as before. Understanding the prognosis of alcohol dependence can help set expectations for recovery. When it comes to alcohol dependence, the road to recovery is often not a straight path, but rather a winding journey with hills and valleys. One important aspect to remember is that relapse is common and should not be viewed as failure. Imagine you're learning to ride a bike. You're bound to fall off a few times before you get the hang of it. And even when you do, there might be days when you lose your balance. But each fall is a learning opportunity, a chance to get back on and try again. This is how we should approach relapse. It's not a sign of defeat, but an integral part of the journey. Now, let's talk numbers. Between 25 to 30% of individuals struggling with alcohol dependence exhibit spontaneous improvement over the course of a year. This means that without formal treatment, these individuals have found ways to reduce their alcohol consumption. While this is encouraging, it's important to note that this doesn't mean professional help isn't necessary. Each individual's journey is unique, and professional guidance can significantly improve chances of long-term recovery. Moreover, 60 to 70% of individuals who have jobs and families experience an improved quality of life 1 year post-treatment. This highlights the positive impact treatment can have, not just on the individual, but also on their relationships and overall lifestyle. It's not just about removing the alcohol, but about rebuilding and improving aspects of one's life that may have been damaged due to alcohol dependence. In conclusion, while the prognosis of alcohol dependence can seem daunting, these statistics should provide hope. Yes, there will be challenges, and yes, relapses may happen. But with each step forward, even if it's followed by 2 steps back, progress is being made. Remember, recovery is not a race. It's not about reaching a finish line. It's about making small, consistent changes that lead to a healthier, happier life. Because at the end of the day, recovery is a journey, not a destination. Scene script: the relationship with alcohol varies widely among individuals. We will investigate the spectrum of alcohol consumption and delve into the specifics of each category, starting with low-risk drinking. Low-risk drinking is characterized by a consumption rate that minimally impacts a person's health and social life. It involves having less than 2 drinks per day, and when broken down by gender, it's less than 9 drinks per week for women and less than 14 drinks per week for men. This moderate level of drinking rarely leads to major health issues or social problems. However, exceeding these limits doesn't necessarily mean one is dependent. It transitions us to the next phase, at-risk drinking. At-risk drinking, a stage marked by consumption above the low-risk level but without any evident alcohol-related physical or social problems. This is a gray area where the individual may seem to function without any immediate negative effects, but the potential for harm is gradually increasing. The risk here is that the individual might not realize they're heading towards a problematic relationship with alcohol, as the signs are subtle and often unnoticeable. Further along the spectrum, we encounter alcohol abuse. Alcohol abuse is when physical or social problems begin to materialize. An individual at this stage continues to drink even when facing repercussions. They may struggle to fulfill their life roles, like being unable to perform at work or maintain relationships, and might also face legal troubles related to their drinking. The crucial point here is that while they're encountering issues linked to their drinking, they show no signs of dependence yet. The final and most severe stage in the spectrum is alcohol dependence, but that's a discussion for another time. Now that comprehend the detailed specifics of low-risk drinking, at-risk drinking, and alcohol abuse, we can make informed decisions about our own alcohol consumption. Each stage reflects a different degree of risk and harm, and recognizing where one is on this spectrum can be the first step towards making healthier choices. What exactly constitutes one standard drink? Let's break it down. So, what does one standard drink look like? It's a measure that's used to help people understand how much alcohol they're consuming. In many countries, including the United States and Canada, one standard drink is generally considered to contain 14 grams of pure alcohol. Now you might be wondering, how does this translate to what I'm actually drinking? Well, let's put it into perspective. 14 grams of pure alcohol is roughly equivalent to 1 12-ounce beer, 1 5-ounce glass of wine, or 1.5 ounces of distilled spirits, like vodka or whiskey. It's important to note that these are approximations, and actual alcohol content can vary based on factors like the type of drink, the brand, and how it's prepared. For instance, craft beers can often have a higher alcohol content than standard beers, and cocktails can contain several standard drinks, depending on the recipe. Understanding what constitutes one standard drink is crucial because it allows us to keep track of our alcohol consumption. It's a tool that can help us make informed decisions about our drinking habits, and it's particularly useful when considering guidelines for low-risk drinking. However, remember that these guidelines are not meant to encourage drinking, but rather to provide a framework for those who choose to drink to do so in a manner that is less likely to cause harm. If you don't drink, there's no recommended amount of alcohol that you should start consuming for health benefits. In fact, it's perfectly okay and healthy not to drink at all. In conclusion, one standard drink equals 14 grams of pure alcohol, which is about 1 12-ounce beer, 1 5-ounce glass of wine, or 1.5 ounces of distilled spirits. Always keep this in mind when you're considering having a drink. Knowing what one standard drink is can help us keep track of our alcohol consumption. Before we end this video, we invite you to become a part of our community by subscribing to our channel. If you found this video informative, give it a thumbs up and check out our other videos for more insights into medical and health knowledge. Stay informed and healthy with us.